Hi everyone, my name is Emin and I'm the co-founder and COO of Epilert. The story started when one of our beloved had epilepsy seizures. So the family is suffering and the friends and also the MDs. That's why Epilert, epilepsy alert. So one of the problems that we face is there is 1 out of 1,000 person has an expected death seizure from epilepsy. The patient can drive, can have a shower, and he can injure himself while having a seizure. So the death is caused when the seizure happens. And also there is the medical doctor struggle from the lack of data. There is no enough data when the seizure happens for the MDs. That's why we want to help caregivers to have a peace of mind for their beloved patients, and also we develop a bracelet that detects epilepsy seizure and sends alert immediately when the seizure happens, and we collect data to improve medical treatment and ultimately trying to predict the seizure in the future with the AI. This is our product. This is our bracelet with 5 sensors. We have the heartbeat and the EDA, the electrodermal activity sensor that detects neurological disease, and also the temperature and accelerometer and gyroscope. So the correlation of the 5 sensors make the detection of epilepsy. This is our system. So it's a bracelet connected to 2 mobile apps, one for the patient, one for the caregivers, and the platform for the MDs, the dashboard, and we use Microsoft Azure cloud system to build our algorithm of detection. This is our business model, $170 for the cost of selling, and $60 in the cost of industry, and $10 monthly subscription fees. We have a niche market in the beginning, which is $2 billion of epilepsy market. We have 3.5 million in the US, and we are going to scale on a market that have plus $100 billion, which is neurological disease and mental health, where we have 1 out of 6 person in the world has a neurological disease. So the go-to-market strategy, we already launched the crowdfunding campaign on Indiegogo. We had 30 pre-orders on the platform and 100 pre-orders through the social media. We are waiting for the FDA in the US. We hope to make the pre-submission in January and to get it by the end of the year. And to make market barriers, we are filing patents for our hardware, our sensor, the EDA, and also IP for the algorithm. And the data acquired later is going to be one of the market barriers that we have. We raised $130K in business angels, and now we are raising $300,000 in equity shares. So our headquarters is in the US, Delaware C Corp company, and all the operations are in Tunisia. We have one competitor. We have more sensors for a better detection accuracy, for a better detection. We have the patient monitoring platform, and also we sell at $170 plus $10 monthly subscription fees. Our roadmap, we are just waiting to submit to the FDA. Our product is ready, and we hope to go to market by the end of the year of 2022. This is our team. We are 4 co-founders. We have board advisor from US, from strategical board advisor, and also technical board advisors. This is our partners from medical to technical, and we achieved a lot in US and in Tunisia. We went through acceleration program and also incubation program. Thank you.
Thank you very much. It's very, very interesting. Are you going to the Africa market?
First, we start with the American market, and then we go to the African market.
Okay, only focus on US market at
right
first.
now, yes.
But the product is
Tunisian product.
The development product is here in Tunisia.
Yes.
But you have partnership also in USA.
Exactly.
Okay, the person need to wear it all day and night.
Yes.
And to plug it to a battery system or something?
It's connected through the Bluetooth to a mobile app, and it needs to be recharged after 24 hours.
Okay, and you also develop the mobile app?
Yeah, the mobile app and the platform of MDs.
Available by a store system, I think?
Not yet, because we are just in the pre-orders phase, the pre-launch, so we didn't put it right now in the Apple Store or Android Store.
Okay, and it is possible to have a subvention system for the product for people who want to use it, or they have to pay each month?
They have to pay each month $10 to use it.
Only 10?
Yeah.
Okay.
Okay, thank you.
You're welcome.
So this is a question I ask a lot of startups that have a hardware component to their value proposition. As soon as hardware gets into it, scaling can get a little bit more challenging. So how are you going to go about scaling the hardware component of your value proposition and the industrialization of the product?
So we are going to industrialize the product in Tunis. We have the right manufacturing to do it, which is partnered also with the Italian company. So it's a company that has the FDA already in the manufacturing. So we can make all the industrial and manufacturing from Tunisia to Italy, and then we can supply all the world from there. And the hardware part to scale, we have a sensor that is our main value proposition. That sensor can detect variability of neurology. We have 2 electrodes in it, and that's the scaling part first, and the second scaling part is to go another market from epilepsy.
Do you have intellectual property over the sensor?
We are filing for the US patents right now, since we just opened in March 2020 the company in US. Thank you.
Thank you.
Time's up.
Oh,
Sorry.
sorry. Thank you, everyone.